All right, I'd like to try and keep us on time as best we can. I'm Joe Friedberg. I'm the co-director of the Penn-Mesothelioma and Pleural program with Dan Sterman here. And I'd like to welcome everyone for coming to our conference this morning. We put together what we hope is going to be a great program, both for the people here, new patients that we've taken care of, people just looking for information, and also, I believe that the program is being videotaped. It's going to be on the web, so for people, we've tried to design the program for people who are trying to get some information about mesothelioma and incorporated a lot of the questions that we hear when we meet the patients. In addition, we're going to have a portion of the program that's going to be sort of what's coming down the road, because in addition to trying to provide the best possible care today, we're working on developing the best possible treatments for tomorrow. Before we get started, just a couple of quick housekeeping things. We're going to have all the speakers are up here. We're going to try and keep all the questions until the end of each section. I'll tell you what those sections are going to be. So please just scribble down your questions, and then the panel will entertain all of them at the conclusion of each section. And then also we'd like to gratefully acknowledge the generous support of our friends and supporters, the Toll Brothers Incorporated, Mr. Brian Efron, Philip and the late Bunny Kendall, and Pinnacle Biologics. We very much appreciate their support in helping this program to be. I'd like to start by introducing Dr. Chi Van Dang. He is the director of our cancer center. He is I'm not going to go through his biography, I'll just tell you he is a world-famous and world-renowned scientist and clinician. And Penn was just incredibly fortunate to get him here as our director of the cancer center. And so with that, Chi.
Good morning. I'm Chi Dang, as you heard, director at Abramson Cancer Center. I've been at Penn now a little bit over 12 months, and it's really been exciting. And clearly this program, as you will hear, is one of the crown jewel of the Cancer Center, being one of the leading center in the United States to take care of mesothelioma. So you're about to listen to some of the world's expert in this area, but despite the fact that the group has already made great headways in handling this disease, and you'll hear about some of the innovations to try to come up with new methods to really deal with this disease. And we're bringing all the expertise of Penn-Medicine to this, including immunotherapy and new ways of doing surgery, as well as phototherapy. And so the mixture, I won't get into the science, you'll hear about them, but this is one program that we are very proud of. And in the past year, we've been able to really engage philanthropy to grow various centers. And it is my duty and as I told you, to help really build this program up even more so than it is today. So we're going to be working together over the next year or so to really expand, because I really think this is one of the big strengths that Penn has, and I really thank my colleagues for doing this. Yeah, thanks.
The morning session is going to include a number of talks, and we tried to do this as very sort of patient-oriented, very clinically oriented. So Dr. Sterman, who is an internationally known expert in mesothelioma, a pulmonologist, and also an immunotherapist, does both clinical and basic research, is going to be giving you an overview of mesothelioma. And then Dr. Leslie Litsky is a pathologist with the program, is also world-renowned with her expertise in diagnosing mesothelioma. And she's going to talk to you about making the diagnosis of mesothelioma. Karen Mudrick, who many of the people in the room already know, is our patient navigator for the Penn Mesothelioma and Pleural program. And she is going to speak about her role in navigating mesothelioma for the patients and the families. I'll then be speaking on the role of surgery in the treatment of mesothelioma. And then Dr. Evan Alley, who joined the program, he just came to Penn last year, is really just one of the best medical oncologists I've ever met in my life. And we are just so fortunate that he's really taken over the helm of the medical oncology role in our program. And he's going to be speaking to you about chemotherapy and the treatment of mesothelioma. And then Dr. Chuck Simone, who in addition to having managed the Yankees, as I understand, is one of the smartest people I've ever met, and he works as a radiation oncologist and is going to be speaking about the role of radiation in the treatment of mesothelioma. And then there'll be a short break, and then Dr. Ruth Steinman is going to speak about the role of the psychiatrist, and she's really focuses on cancer patients and the role of the psychiatrist, because as everyone in this room knows, this is a stress that a person is not supposed to go through. Then we have one of our patients, Mr. and Mrs. James Abel, Mr. Abel and his wife, and they're going to come up and they're going to speak about the patient and the family experience. I think that's going to be very valuable for everyone. And then at that point, the panel will entertain all questions, and that will conclude the very morning portion. So with that, I'd like to turn over to Dr. Sterman.
Thank you, Joe, and thank you all for being here today early on a Friday morning. I know how hard it was for me to get up, and so I really appreciate you being here. And it's always an honor to speak before patients and families regarding what we do at the Penn Mesothelioma program, because we would not exist because of you. Your dedication to us, your trust in us, and this today is our way of, in some part, giving back to all your trust and dedication. I also have a very difficult task for the next, 10 minutes. He'll be counting down the seconds and waving the red flag. I'm doing two things. One is I'm telling you things you pretty much already know, because mesothelioma patients and families often do tremendous amounts of research into the disease even before they come to us. And secondly, I'm preaching a bit to the converted, because you've been in some way, many of you, involved with our program already, so you know a little bit about what our interests are and how we hope to fight this disease now and in the future. So some of this is going to be review. Some of it might be new. Some of it may be an introduction to what we hope to provide for you over the course of the next hour or so. So bear with me at least for this overview, and then later on in the morning I think I get a chance to talk a little bit about some of the new cool stuff that we're doing. So hopefully I figure out how to advance this. Okay. So my job is to give you a little bit of overview into the disease malignant mesothelioma. And on the left-hand side, you can see a drawing of what malignant pleural mesothelioma, that is mesothelioma of the chest, looks like. This is a drawing made by a famous physician named Frank Netter, who really made his name by making these incredible color picture drawings of the anatomy of the body and of disease states. And this is a very characteristic drawing of mesothelioma, which shows in the whitish areas, and I don't know if I have a laser pointer here somewhere. Let's see if I can find it. Maybe not. In the whitish areas on the right-hand side, the left-hand side surrounding the lung, the tumor encircling the lung and causing shortness of breath, pain, most of the symptoms of this disease. But I think it's important to know that mesothelioma is not just a disease of the chest. It can involve the belly. In the male, it can involve the scrotum. It can sometimes involve the heart. But the vast majority of patients will have mesothelioma arising in the chest. Is there a laser pointer on here somewhere? Oh, there it is. It's just small. Sorry about that. I think it's really important to know that there are different varieties of mesothelioma. So when you get your diagnosis, and we'll hear more about that from Dr. Litsky today, it's not just, do you have mesothelioma, but what kind of mesothelioma? There are different types, and we'll hear about that. And increasingly, I think in the future, it's not just going to be what kind, but what is the specific mutation that's causing your mesothelioma? And we'll be talking more about that in the future. I think that it's also important to know that this disease affects patients differently than other cancers. Other cancers may arise in an organ and rapidly spread to other parts of the body, and you're dealing very early on with a metastatic situation. In mesothelioma, the disease tends to start locally and sort of progress locally, and most of the symptoms are related to that local progression. And yes, patients can develop disease elsewhere in their body, but that's not usually early on a major phenomenon. Unlike most other cancers, in mesothelioma, we pretty much know what the offending agent is. And this is kind of interesting. You have stomach cancer, you've got pancreatic cancer. For the most part, although there's millions of dollars going to research, we don't know what the cause is. In mesothelioma, for a long time now, we have known that the offending agent is, this mineral, which unfortunately is ubiquitous in our environment, both here in the United States and abroad. And if you look at the medical literature, about 80% of patients with at least mesothelioma of the pleura, of the lining of the lung and the chest wall, have a known exposure to asbestos. But the other 20% probably were exposed to a significant degree, but didn't really know, can't pinpoint it because it's in the environment. We just don't know where they were exposed to. And these exposures are mostly occupational, and many of you may have done these occupations. Some asbestos mining and processing. Luckily, we don't have asbestos mines in the Philadelphia area, but if you're from Quebec or South Africa or Australia, this is a significant part of how you might be exposed. In this area, pipe fitters, insulators, shipbuilders, brake repairers, construction workers, plumbers, the list goes on. But also increasingly, we're learning of other things, environmental exposures. If you live in the Ambler area, just by riding your bike around town, you could be exposed because there was an asbestos tile dump in the Ambler area. If you were a woman who washed your husband's clothes, you could be exposed and develop mesothelioma. If you just lived in a building that was contaminated. And so we know the offending agent. And you would think that with that knowledge, we would be able to ban asbestos and prevent this problem in the future. Well, we have not yet done that, but we need to do that. The important thing is that it's 2012, and yet we have not yet seen the peak of the problem of mesothelioma. This is England, this is not the United States, but what you see is this is asbestos imports into the United Kingdom. And these are men who are dying from mesothelioma. And this is the peak expected in 10 years from now. In 10 years from now, 1 in 100 men in the United Kingdom will die from mesothelioma. 1 in 100 men. That's how much the exposure is going to lead to a catastrophe. And it's not just in England. So increasingly worldwide, this is a problem. And part of the problem is under-recognition of a problem. In the Far East, for example. But in Korea, in Hong Kong, in Japan, in Singapore, they're now showing a significant rise, which is directly correlated to basically the unmitigated use of asbestos in those countries. Forget about Russia and India, where it's even worse. So this is a worldwide epidemic that we're just getting a handle on in the US, but we're going to be dealing with for centuries. Now, it's important to understand that as dire as the situation is in terms of the risk to people around the world from asbestos exposure, that we're making tremendous advances in diagnosis of mesothelioma, the staging of this disease, treatment, and research. And this is providing hope to patients and families and to all of us that we will provide tremendous advances in patient survival over the course of the next few years. My goal over the next couple minutes is to give you just a glimpse of why we have such hope. And you're going to hear from all of my colleagues about the advances that we're making at the University of Pennsylvania. So as a pulmonologist, I get very much involved in the diagnosis of patients with mesothelioma. And you'll hear from my colleague, Dr. Leslie Litsky from the Department of Pathology at Penn, about how we make the diagnosis. But for me, some of the exciting things are that there are new ways that we can make the diagnosis and staging of mesothelioma in less invasive ways. One of them is a technique that we have available at Penn called endobronchial ultrasound, and groups MD Anderson, for example, the Cancer Center down in Houston, have shown that you can use this minimally invasive approach with a scope going down through the throat, using ultrasound to biopsy lymph nodes and to make the diagnosis of this disease in certain cases. So to me, that's exciting because the ability to provide information to patients and families without needing to go into operation may be a great advance. This is an advance that you wouldn't really think is an advance, and this is the advance in imaging. So mesothelioma I like to tell patients, and you may remember this from my spiel when you first meet with me in the office, it's a difficult disease to measure if you think about it. If you have a stomach cancer, for example, you present with a mass. It's almost like a sphere, and it's fairly easy to measure. If you have mesothelioma, it's difficult to quantify. How do you quantify what's here? And so one of the major advances in the last 10 years in mesothelioma has been a systematic way of measuring the amount of disease from one scan to the next, so we can adequately quantify how much benefit you're getting from whatever treatment. Because before, it was kind of haphazard. It's called the modified RECIST. It was developed by 2 oncologists from Australia who we collaborate with very closely, and it really has changed how we're able to implement new therapies, because if you can't measure it, you can't decide whether a new therapy is effective. And even more recently, it has been the implementation of PET CT scans. Many of you who are patients with mesothelioma have been through this study, and the reason why it's so important is that you can take someone's scan that looks like this and not really know what's scar tissue, what might be fibrosis from having talc in your chest, and what is actually the tumor. And here on the PET scan, you can see lighting up in the bright yellow the areas of the tumor that more clearly define. And this is increasingly important as we're diagnosing, staging, evaluating treatments in patients with mesothelioma. You'll hear from Dr. Evan Alley, our thoracic medical oncologist extraordinaire, about the advances in chemotherapy. I wanted to just say that it's been almost 10 years since the first and really only drug that was approved for mesothelioma, pemetrexed, otherwise known as Alimta, was presented in the medical literature. This is the study that really was a landmark study that showed that this chemotherapy drug is able to prolong the life of patients with mesothelioma. And this is not where we need to be. We need to be providing cures for this disease, but it was a fantastic start. And what we've done at Penn, for example, is to find ways to take biopsies and to look at the biopsies and try to predict if you have a lot of staining or very little staining for a specific enzyme that can process this drug, can we predict who might benefit or won't benefit from chemotherapy? Therefore, selecting patients who are likely to do well and patients who might need to get a different drug. So we're just starting to do that, but we've been on the forefront of that development. You're going to hear from Dr. Sengel and Dr. Simone about the advances in radiation therapy. This is a slide showing one type of radiation therapy called IMRT that really is changing the way that we treat this disease. You'll hear more about that from my colleagues in radiation oncology. But we're trying to incorporate more and more radiation therapy into the multidisciplinary treatment of mesothelioma, try to prolong survivals, decrease local recurrences, and improve quality of life. And I think a big focus of our program, and you'll hear this from Dr. Friedberg, have been advances in surgery. And we have been clearly world leaders in what we call lung-sparing surgery for mesothelioma. And my colleague Joe Friedberg is clearly a world's expert in this area, a very humble man. This is a remarkable advance, an incredibly intricate operation that only a few people can do, and Joe is one of the best, if not the best. And this advance leaves people with a remarkably improved quality of life with 2 lungs. And I can't underestimate the importance to our patients of that advantage. To allow him to do that, we worked together with our colleagues in radiation oncology to give a new type of treatment inside the chest cavity. So unfortunately, even the best surgeons who operate in mesothelioma are going to leave microscopic cells behind. So we need some way to try to treat those cells that the surgeon, even the best surgeon, can't see when he or she is in the operating room. And so at Penn, we've been world leaders in using a new type of therapy called photodynamic therapy, or PDT, which is a combination of a light-sensitizing chemical and a specific form of laser light inside the chest cavity to treat those remaining cells. And you're going to hear about the remarkable benefits and advances of this new technology for patients with mesothelioma. My work as a pulmonologist, along with my colleagues in pulmonary and interventional pulmonary, Steve Albelda, Andy Haas, Edmund Moon, Anthony Lanfranco, and Ilva Chani, has been in experimental therapies for mesothelioma. And I'm going to be telling you a little bit later on about our gene therapy trials for mesothelioma and where we stand in terms of combining these trials with some of the other exciting treatments that we're going to be talking about today. You'll also be hearing later on from my colleague Dr. Moon about one of the clinical trials that we have at Penn that was pioneered at the University of Pennsylvania. And this is a trial in which we take a patient's own white blood cells, modify them outside their body, and essentially make them what we call little smart bombs that go and find the cancer where it exists. We still have a long way to go to perfect this. There's still some bugs in terms of side effect profiles we need to work on, but we think that this type of technology for the future may prove to be a dramatic advance for the treatment of mesothelioma, and we're just starting to evaluate it at Penn. Of all the advances that I have mentioned in the last few minutes, there is no greater advance, in my opinion, than the advance in multidisciplinary patient care. You are the best judges of that because you've been through the process on the other side. But in my opinion, what we've done with the help of the people who have supported our program all along has been to bring everyone together in one room, so that when you come to visit us, your cases are presented by the entire group, to the entire group, we discuss them, and then you're able to see each one of us individually but together on the same day. To have a consensus opinion, not have to come back for multiple visits to get a disjointed opinion. And what you see here is the list of individuals that participate in the program, and the list is tremendous. Thoracic surgery, thoracic medical oncology, radiation oncology, radiology, surgical oncology for those peritoneal mesothelioma patients, pulmonary medicine, pathology, psychiatry, and we have 5 different laboratories at the University of Pennsylvania, each of which are focused on one area of treatment of mesothelioma. So I am so proud to be part of this team, and we really truly are a team, and we are here for you, and I hope you'll enjoy the rest of the morning. Thank you very much.
And that was spectacular. I think we're done, actually. It was pretty much perfect, is the word that comes to mind.